I'm Rosalie Schaefer, and on behalf of the League of Women Voters of Manatee County, I welcome you to our program today. First, I'd like to recognize some public officials in our audience. We have Karen Carpenter, the chairperson of the school board, and Michael Gowan, county commissioner. Did I miss anybody? Okay. Today we are going to talk about a very important and contentious problem. In recent years, our country has witnessed a large number of multiple homicides, many committed by mentally ill offenders, using firearms with tragic results. Leaders of both parties are currently struggling to find solutions to help reduce these occurrences, while schools, theaters, and workplaces are trying to figure out how they can best protect their students, customers, and staff. How can we save lives while preserving rights? We are very pleased to have with us today some local experts who can share their knowledge and experiences. Mary Ruiz, President and CEO of Manatee Glens Treatment Center. Lieutenant Lorenzo Waiters, Crime Prevention Supervisor with the Manatee County Sheriff's Department. And Margaret Moore, Local Representative of the National Alliance on Mental Illness. Our format today will be, each speaker will give a 10-minute presentation. After that, we will have questions and discussion from the audience. At that point, please use the microphone on the floor for your question and state your name. You may address your question to one of our panelists or to all of them. And the topic today can be contentious, so I ask all of you that when you disagree, please do so respectfully. Okay, without further ado, we will start. Mary Ruiz.
I want to thank Rosalie and the League for arranging this panel. Maybe today we can be part of bringing our nation away from hysteria and divisiveness towards finding a unified consensus that will improve the health and safety for all of us. At least we can give it a try, right? Well, first, I think we should take a look at some cold hard facts. Knowledge without data is just opinion. And there are plenty of opinions to go around, but they're not always useful in solving real problems. Number one, very few people who are mentally ill are also violent. The U.S. Department of Justice says that only 3% of the violence committed in America is attributable to mentally ill people. So the rates of violence among mentally ill people is actually lower than the general population. You are safer with mentally ill people than you are the rest of us. Violence, however, is best predicted by two things. One is a history of past violence, including domestic violence, and a history of substance abuse. Violence in our community and throughout the nation is not generally committed by strangers. 2/3 of the homicides were committed by familiars or members of the family. So it seems that domestic violence is a greater concern, perhaps, than stranger violence. In the U.S., in the state of Florida, in the county of Manatee, many more people die from suicide than firearms. In the U.S. Armed Forces, which is a job where you carry a gun and you're facing people who also carry a gun, who want to kill you. In the U.S. Armed Forces, more soldiers die from suicide than combat. So it seems that a treatable mental condition is taking far more lives than firearm violence. In Manatee County, the top reason that young people 15 to 24 meet an untimely death are drug overdoses. Drug overdoses. In fact, overdoses and suicide took more young adults in our county than firearms and traffic accidents combined for this age group. We lost, between the years of 1999 and 2010, in this county, Manatee County, we lost 75 young people to overdoses. We lost 17 to suicide. We lost 49 to firearms. So it seems that drug abuse is taking more lives than even mental illness. If you had any doubts that politics can make for strange bedfellows, what I'm about to tell you may change your mind. The NRA Legislative Director, Chris Cox, says American gun owners and the Second Amendment supporters are ready for Washington to put politics aside and come together to fix our broken mental health system. Wow. Is our mental health system broken? Or is it neglected? Both. During the recession, $4.35 billion, that's with a B like boy, billion dollars were cut from our nation's mental health system. Right now, this week, I'm advocating with the Florida Senate to deter them, or hope to deter them, from cutting $1.3 million in mental health services for 3,000 people here in Manatee County. Primary care doctors, anybody want to guess how many hours of their medical school training are devoted to mental health and addictions disorders? Zero. That's the norm. The most any med school offers is 6 hours. So our primary care doctors aren't prepared to screen or treat these disorders. Less than 2% of all children have scoliosis. That's a curvature of the spine that can be very disabling if not treated and addressed. We screen for scoliosis in our schools nationwide. We do not screen for mental health and addiction disorders, which affect 20% of the children. So we screen for a 2% disease. We do not screen for a 20% disease. Do you know what the most common diagnosis among kids is? Anxiety. America has the highest rate of anxiety of any developed country. No insurance, including Medicare, covers mental health and addictions equally, even though 4 years ago we have a federal law that says it will be covered equally. We have yet to develop the regulations that would enforce that law 4 years later. As a result of this neglect, 1 out of 3 adults who has a mental illness goes treated. The rest go unidentified and untreated. And 70% of the children go unidentified and therefore not treated. Don't worry, though, the jails and the prisons are taking up the slack. The U.S. Department of Justice notes 16% of adults incarcerated are seriously mentally ill, have committed no violent offense. Juvenile justice system, this will break your heart. 41% of those kids have a mental health disorder, and we're treating it with a justice system response. In 2009, 27% of all arrests were attributed to alcohol and drug offenses. I have a feeling that alcohol and drugs were involved in a lot more. We'll probably hear more about that from Lorenzo. So today, the United States has the highest documented rate of incarceration of any developed country. So, Chris Cox of the NRA says the system is broken. What are we going to do to fix it? Representative Debbie Stabenow of the U.S. Congress has filed a bill creating standards and funding for a federally qualified behavioral health center. Let's go for it. Florida is 49th out of 50 states and the District of Columbia for mental health funding. If we triple the amount of funding in Florida for mental health, we will be at the average if we triple it. Our Manatee County schools have committed to working on a task force to look at screening ninth graders. Why ninth graders? At age 14, 50% of the major mental illnesses are starting to manifest. If we can find these kids before their illness becomes full-blown, we may be able to prevent it from developing into a lifetime disability. So it's worth a try. We need to require our medical schools to offer substantive mental health and addictions treatment. How many people here have ever had their doctor ask a screening question for mental health or addictions? My doctor asked me how many drinks a week. I think that's the only question. So that's a problem because they're very common disorders and they're highly treatable. We need to restrict the legal and illegal availability of prescription pain pills. We're losing 7 a day in Florida. Manatee County is a high-risk area. We need to multiply the funding and availability of substance abuse. If everyone came to Manatee Glens today who needed treatment, we would only have enough treatment for 18% of the people who are addicted. And so if we truly were able to make prevention and early intervention and prompt treatment and the end of discrimination and the end of stigma and recovery support available for a whole generation, then maybe our biggest problem wouldn't be untreated brain disorders, which is our greatest threat, I believe, to our health and safety. And we could work on a problem that affects far fewer people, which is gun violence. Thank you.
Good afternoon. I have my glasses. On behalf of myself and Sheriff Stubbe, thank you for inviting us here. Let me tell you about me. I've been employed at the Sheriff's Office for 32 years. In that 32 years, I've done a variety of things. I've been a hostage negotiator for 25 of those 32 years, and now I am in charge of the team. And I will tell you, when I originally started, I knew nothing about mental illness. When I really started, it was considered everybody was crazy. That was it. There was no label. You were just crazy. So as I matured through my years, I had an opportunity to get the position as hostage negotiator, and we had to attend a 40-hour class. And in that 40-hour class, they did talk about bipolar and everything else, and I'm like, that doesn't concern me. So I went back, and I still had no idea what I was doing. So I had the opportunity to work security in Manatee Memorial Hospital, and when the triage nurse came in, she said, well, you stay up front. If I get a patient, come and get me. So this one guy comes up, and he started scratching himself, and he says, can you get the nurse? You know, I'm bipolar. I said, okay. So I get the nurse, the guy's bipolar. She comes up, she takes care of him. Next time I work there, he says the same thing. So I thought bipolar was some kind of a skin disease, you know, because I didn't know. But as I matured through the agency and got more involved in emergency services and hostage negotiations, there was a class called CIT, which is Crisis Intervention Training. So I attended that, and it gave me more knowledge to help myself in the field that I'm working in and the guys that work at the agency. So we work closely with Manatee Glens. So I just wanted to build that foundation to give you an idea about me and why I have a passion for this. So a question to you all. When we try to figure out somebody that has a mental illness or not, and we try to figure out the norm, who sets that standard to say that you are normal or you're not? Who sets that? Where's the bar? Are you normal or you're not? Right? I mean, how do we set that? Last year, in 2008, we all know what Baker Act is, right? Okay. Over 800 people were Baker Acted. 800. And I can tell you that at that 800, none of them had guns. I can tell you that. So if you look at just the 800 in Manatee County and being a negotiator, the majority of the calls that we have for the negotiation team are people with a mental illness that are looking for help. They're looking for help. So what happens when things like Connecticut and in theater, and we put a label and say they must be crazy, that's why they did it, or they have a mental illness, that's why they did it. So I put another question to you. It could be depression, bipolar, and schizophrenic, right? That's a mental illness. Or depression, okay? So look at it this way. So those parents of those 22 kids, do you think they're gonna wind up suffering with depression? Okay? And the reason I say that is because I lost a child at 17 years old. So I come to work with a gun every day. Does people run from me? Nobody runs from me because I don't plan on shooting anybody. So we can't say that people with mental illness is going to go around and shooting people or killing people. They're most likely to be a victim of a crime rather than committing a crime. I can tell you when I was going through the training, my first training with CIT, there was a young lady, because in that training, we have an opportunity to meet the clients. And a young lady, probably in her 20s, and she said that she heard voices. And she told the deputies that were in the room with us, she said, when I'm have an episode, she said, or in crisis, she said, if I'm hearing 2 or 3 voices, she says, can you just have one law enforcement officer talk to me? Because if I hear 2 or 3 and I got 2 officers, she said, how do I know which is the right one? How do I know? And the other officer said, oh, you're right. It does make sense. So when we go through that training, it helps the officers because they know nothing about mental health, nothing. They get a call, they go to a house, they spend 15, 20 minutes, they have to figure out what are they gonna do. Do we Baker Act or do we leave them? And in the past, they didn't know what the resources were at Manatee Glens. Now they do. Because it's all about a service that we, as in the sheriff's office, give, whether you have a mental illness or you're just a regular citizen. We give you that same service. You know, it doesn't switch. I mean, if we come and your house is broken into, we're gonna give you good service. If we come to your house because a loved one is in crisis, we're gonna give the same level of service, but it's just gonna go in 2 directions. So when people with mental illness are stigmatized, they're not gonna go out and seek treatment. Because now they're thinking, if I go out and seek a doctor or counseling, a psychiatrist, somebody's gonna know, and they're gonna put a label on me, and everybody knows, because that's what they're gonna think. So we're gonna have more people out that's not getting treated, you know, that has a mental illness. And that's what happens. And with funding cut in the state of Florida, and then you think about the local here with law enforcement, that cut. So we work less with more situations. So there's a strain with Manatee Glens and with us. But I can tell you this, when she spoke about people with mental illness in jail, we work closely with them to make sure they still receive the services. And the people that won't seek help, for medications, they self-medicate. They'll go in, they'll smoke crack cocaine, heroin, marijuana, whatever. And then that just makes the problem worse. So when it makes it worse, we don't know if that person needs to be Baker Acted or they need to go to jail. Now, the reason behind the crisis intervention training was because I would say probably a good 10, 15 years ago, there was an incident that was in Memphis where there was 3 or 4 police officers at a scene, and they wound up killing the patient. So they wound up the agency got sued. So part of it was they had to start some training. And then the training started nationwide. And I think our agency has been doing it close to 10 years now. So it's been beneficial for our agency. And thank you. And I tell you this, if you know, when there's a shooting, whether it's a school or someplace else, the first thing that people think, it's somebody has a mental illness. And you can't really, and the problem is that if that person commits suicide, we'll never know why they did it. You never know. You think about this. We had a husband kill his wife by hitting her with a baseball bat. So, is he sane? Or does he have a mental illness? You have a guy that had visitation rights with his daughter here in Manatee County. He takes her up to Ohio. He killed his daughter. He commits suicide. Was he sane? Or does he have a mental illness? We don't know. So we should be careful with saying that everybody that shoots somebody is a person with mental illness. Thank you.
Good afternoon. I am the mother of a 49-year-old son who could have been one of the shooters in the recent tragedies, as he developed paranoid schizophrenia at the age of 18. Instead, I am here today to happily share my son's successful uphill climb to overcome his disability, to demonstrate that adequate medical coverage and good local programs for the mentally ill work. My kind, thoughtful, intelligent son turned into a very disagreeable, hostile stranger at age 18, quit college and his part-time job, and refused to get medical help. I used tough love and kicked him out of the house and changed the locks. That was the hardest thing I ever did in my life. For 10 years, he tried various cities, jobs, and apartments without any medical coverage. He returned to our home the last 2 of the 10 years as his condition worsened and he couldn't work. We reached a crisis stage when he threatened me, nearly was arrested, and I became the enemy. I finally learned about a program for the mentally ill in Alexandria, Virginia, where we lived. Following are just a few of the excellent services this program provided that saved my son from being in a mental hospital, in prison, or dead. Psychiatric diagnosis and weekly counseling, and powerful psychotropic shots every 2 weeks, which continue to work today. A clubhouse program providing job and personal counseling 5 days a week, supervised group homes and apartments for 5 years, assistance in obtaining jobs at the U.S. Patent Office and a Target store, for example, with medical coverage. He was retired from the Alexandria program when he started working as a mail clerk at an Army National Guard Readiness Center for 5 years with medical benefits. I'm so proud to say he became a full-time employee as a mail clerk at the Internal Revenue Service in Washington, D.C. 5 years ago. Still, his continuing medications and visits to a psychiatrist would be extremely prohibitive if he didn't have medical benefits, since he has a low entry-level salary. Once again, he is the kind, thoughtful, intelligent person he was before he got sick, lives independently in Arlington, Virginia, and now thanks me for never giving up on him. He now pays federal, state, and local taxes instead of the state having to pay approximately $50,000 a year to house him in a prison, or approximately $208,000 per year in a mental hospital. I give the National Alliance on Mental Illness, NAMI, so much credit for helping me save my son. Before I attended my first family support monthly meeting in Alexandria, I thought I was the only parent dealing with this scary problem. I felt so frustrated and so down. There were about 15 family members at this first meeting whom I learned had similar problems, including one parent who told of his daughter's success story. I gained hope as I learned about the Alexandria programs that could help my son. Are you aware that 1 in 4 adults in the United States experience a mental problem any year, and 1 in 10 youth live with a mental health condition that interferes with their day-to-day lives? 60% of these persons receive no treatment. These numbers will increase as the soldiers return from Iraq and Afghanistan. Thus, our Manatee County NAMI Advocacy Committee, of which I am a member, has and will lobby our U.S. Senators Rubio and Nelson and Representative Buchanan to, number one, prevent this sequestration that's looming, which will severely cut our current funds for housing, treatment, and future research by the National Institute of Mental Health in Washington, D.C. Number two, support parity, which is equal coverage by health insurance companies for mental illnesses as for other physical illnesses, which is not the case today. Number three, Senator Rubio also has introduced a bill on February 7th, beside the one that Mary mentioned, with 6 other senators for expanded access to community mental health centers. If you or your friends or acquaintances have a family member in a possible mental crisis, you are welcome to attend our local Manatee County NAMI affiliate, which meets the 2nd and 4th Mondays of the month at 7 p.m. near the corner of 41 Cortez. The address of our current meeting location is on the colored brochures on the round table back there near the door. And on it is also phone numbers of 2 longtime members that you could call for information or help. NAMI was founded in 1979 as a grassroots mental health organization dedicated to eradicating mental illnesses and improving the lives of persons living with them. It has affiliates in every state in local communities, including 34 in Florida. Our Manatee County affiliate has 3 missions. First, to support family members who have a loved one with a severe mental illness by sharing our experiences and offering help. Second, to educate the general public through presentations such as this one today. Third, to advocate for the mentally ill through collaboration with community organizations such as Manatee Glens and the Sheriff's Office. Our affiliate provided over $21,000 last year in emergency financial assistance to Manatee County individuals who had been referred by their caseworkers at Manatee Glens for things like utility bills, rent assistance, medications, and medication copays. These funds came from donations and are, fortunately, being a beneficiary of a trust since 2008. Florida is at risk of having one of these national tragedies because, as Mary mentioned, we're 49th in the nation in state money spent for mental health services, and when NAMI graded the states in 2009 on mental health services provided, Florida got a D. Thus, our committee has and will lobby our Senators Galvano and Joyner and Representatives Stubbe, Boyd, and Rusan to increase funding this year for local mental or substance abuse programs, even though Governor Scott's proposed budget does not increase funding for these services, which were cut under his previous budgets. Also, as Mary and mentioned, the jails and prisons have become unsatisfactory facilities that house the mentally ill. Our local jail currently houses approximately 400 mentally ill persons. One of our advocacy committee members visited the jail in January, Ed Jans, who is one of our guests here today, and learned that the highest percentages of incarcerations are due to violations of parole, meaning not keeping court dates. Our committee is pursuing ways to help prevent this high rate of recidivism and other projects to help prisoners upon their release from jail. For example, finding halfway housing and education in Planned Parenthood for women. I will close with a suggestion regarding gun control made by Robert Gates, the former Secretary of Defense and former head of the CIA, who spoke at a Ringling Town Hall on February 5th at Van Wezel. People should be required to take a safety training course and pass a test to get a license to own a gun, as we have to do to drive a car, which is also a killer. I urge you to talk with or write to your legislators asking for more increased funding for local programs so possible gun violence due to guns in Florida can be prevented. And other parents may be able to say, I got my son back. Thank you.
Thank you for those excellent presentations. We're ready for questions from the audience now. Please use the microphone on the floor to ask your question, and the speakers will have to return to the podium to answer the question so that we can get their response on the METV tape. Thank you.
I'm Nancy Horn, and my question is for Mary Wiz. I don't think this is just for the camera, so maybe could someone repeat, because I'm not much of a loud talker. But the question we had after the Newtown killings was, what could have been done to prevent that young man from doing that? I wonder, in all of your experience, if you have some kind of solution.
We take the question, in case you didn't hear it, is in the case of the Newtown young man, Adam Lanza, who killed the children and the teachers and administrators, what could have been done? What could have been different? Adam Lanza's mother was alone in trying to deal with the problems. She knew her son was sick. She was attempting to find services. The services that are available typically are not intensive enough because they're more expensive. And so for me, it's like telling families that your loved one needs open heart surgery and handing them a kitchen knife and say, you're on your own. Figure it out. It's not that medical science doesn't know what to do for Adam Lanza. We screen, we intervene, we offer the kinds of services that Margaret itemized. Here in Manatee County, we have an assertive community treatment team. It's a hospital without walls. We go in the home, the nurse knocks on your door, here are your meds, how are you feeling? The doctor visits you at home. You get housing subsidy, medication support. That costs $12,500 a year versus the $200,000 a year that a mental hospital would cost, or the $50,000 that jail would cost. So we know what to do. We have medical protocols that are proven and evidence-based. We don't have enough of it. So we're like a third world country where penicillin could save so many lives, but there just isn't enough penicillin.
I want to thank you guys for doing this, first of all. A couple of you alluded to it, but maybe without taking up the next 4 hours, could somebody summarize, is the Affordable Care Act, as you stretch it out to whenever it's completed, 2020 or whatever, going to address any of the issues you brought up? Depress me and say no.
The Affordable Health Care Act includes mental health and addictions treatment as a mandatory benefit. It expands health insurance to people who currently have no medical benefits. And I think Margaret made a very eloquent case for the importance of medical benefits, given how expensive medical treatment is for working people. So it will dramatically impact the availability of access to care. My concern on the receiving end is we have salaries that are below par. Young people are not seeking these fields as a result. And so will we have the workforce because these are specialties. There are many years of training. The difference between a primary care physician and a psychiatrist is 4 more years of training. So we have concerns about being able to expand, but I think that the expansion will not come overnight. They're expecting a 3-year ramp up for people to enroll because right now people are eligible for Medicaid who don't apply for Medicaid for a lot of reasons. So I think that the affordable health care will go a long way towards making treatment available, and it's a good thing.
Suzanne Dickey. This may also be for Mary or any of the three. Could you say something a little bit more definite about, this follows up on Lorenzo's comment, I think. What is the borderline between physical and mental illness? There's some obvious cases everyone easily talks about, schizophrenia, but anxiety, depression, what really counts?
Did everybody hear the question? What is a mental illness? I think is the summary of it. It's a shame that we're so confused about it. And most of us are confused about what is a mental illness. Mental illnesses are brain disorders. Something is physically wrong with an organ in your body, which is the most complex organ in your body, which is your brain. And so these medical illnesses have a physical manifestation in your brain that impact your ability to function, your behavior, your moods. And so we have a diagnostic manual this thick. It's called the DSM-4, soon to be 5, that will tell you every possible mental illness. And the joke always is, everyone has one. When does it become serious? Well, you can have a cut and it's a little red. Are you going to go to the doctor for that? Probably not. You're going to put some antiseptic cream and a Band-Aid on it. If a red line goes up your arm, you better go to the doctor. And mental illnesses are the same way. If you have anxiety because you're going to speak before people, or you're worried about a loved one's surgery, okay, you're not going to go to the doctor for that. But if you wake up in the middle of the night for no good reason, worried for no good thing, and it persists day after day, week after week, you need to go to the doctor. So in part, these mental illnesses are on a spectrum. Some require attention, some don't. We can be depressed, or we can be clinically depressed, which means that the structure of our brain has been altered. And so we need medical attention. I think it's difficult for us to recognize these things. We're not schooled in it. Lorenzo is our poster child for crisis intervention training. He didn't tell you this, but he didn't want to go to that first training. And now he's the guy that we can count on to recruit other law enforcement officers to it. So there's something called mental health first aid, and it is one of the president's recommendations. And what that is a 12-hour training that answers your question in more detail. What is a mental illness? What are the signs and symptoms? What do you do about it as somebody who cares about somebody who may be in a crisis? What are the good things to do and what are the bad things to do? Where is help available? How serious is it? And we hope to be training trainers in the year so that we can offer that training to people in the school system and the general public, so that maybe a year from now you'll be able to answer that question for yourself.
My name is Jo Williams, and I just want to follow up on what you said and the question that was asked before. For many, many years now, I've heard of young people who are right around the age of 18, something happens to them, and they become schizophrenic or bipolar, and they have these big problems. And I'm wondering, is there information about why this happens around the age of 18 to so many young people?
So why is it that so many young people who are going to experience a mental illness do so around college, about the end of high school, beginning of college? The progression of the disease is such that many of these symptoms are starting to manifest when people are in their early teenage years. But if you were to list those symptoms, they would describe every teenager in America. Moodiness and isolation and reactive, and I don't know a teenager who isn't like that sometimes. So it's difficult for people to sort that out, but the manifestation is there in the early teen years. What happens by the time that the kids are 18, 19, 20, 21 is they can't hide it anymore. They're so sick, they can't hide it anymore. That's why screening is so important. Nobody has to get that sick before they get help. 50% of the major mental illnesses manifest before age 14. Many parents will say, in retrospect, now that I know so much, I see it now, didn't understand what was happening in the beginning. So training everyone in mental health first aid, doing routine screening, so we're not relying on parents to be medical geniuses without any training, that they can get help and alternatives. I think that's the way to be able to say in this next generation, not so many people are having these experiences at 18 and 19. It's really dangerous, too, because they're away from home many times. And so frightening things can happen before they get to attention. And at 18, you're no longer legally, the guardian. They're adults. So those are all reasons I think where early screening are really, really, really important.
Ann McFarland. And my question is regarding the more of the legal aspect. The big debate right now is, are we going to have background checks? And if we have background checks, of course, we don't want people who are seriously mentally ill to be able to purchase weapons. Now, on the one hand, I feel, yeah, that's a great idea. But then on the other hand, I do have a concern about the rights of people. I guess my question is, how are we going to make this list of people that shouldn't have guns? Is it going to stigmatize these people? I would like to know, yeah, I think maybe that's a question for the lieutenant. How are we going to make this list of people who are mentally ill enough to not have guns?
Honestly, I don't think they've figured that part out. Because if you really, really think about it, who's going to walk in and say, hey, I want to buy that gun, but, I have a mental illness? It's still in progress, work in progress. And it's just like if somebody walked in to get a driver's license and they ask, do you have a mental illness? I mean, yeah, but most people, they're not going to say anything because it's part of your medical record. And even though it's a mental illness, it's still a medical, am I right? So who do you have to disclose that to? Or who would you disclose that to?
Then is it the doctor's responsibility and the hospitals to put these people on a list? That same question that you asked, a couple of us in the office, we were discussing that. So we couldn't figure it out. As a matter of fact, it was, we're at Manatee Glens and we were talking about that. So unless you gave it to them or told them, I couldn't tell you. So.
My name's Ed Patton. I'm from New York. I have an opinion and I have a question, but so you know where my opinion's coming from, at least you don't think I'm some guy off the street that watches TV and reads the newspaper and that's where the opinion comes from. I have a master's degree from Syracuse University in counseling. I have a master's degree in education from Elmira College in Elmira, New York. I worked for over 3 years as a social worker for the local social services department up in New York.
And are you looking for a job?
No, no, that's not. If I don't say that, I'll get it through real quick. I just didn't want you to think I didn't have anything, behind me. I was hired by the state of New York to work with the socially and culturally disadvantaged for many years. Where this has taken me is to, I might also add, I worked as a correction officer for the local sheriff's department in the county jail. So I have all that coming into this, right? And where this has brought me is I've read numerous mental hygiene treatment reports, psychiatric records. I've been involved with Binghamton Psychiatric Hospital in Binghamton, New York, Elmira Psychiatric Hospital. And I've also worked with like the local, we call it the behavioral science unit at our local community hospital. And I've worked with therapists, social workers, psychologists. So I have a lot of that in my background. What I didn't hear anybody talk about here today, and this gets into Lorenzo's comments, are you sane or not insane, or who could we let these people have the guns to? And I'm gonna reference is it Mary? Okay. When you were talking about the DSM-4R, I know what that is. I've used that. Okay, and what nobody's talked about here today, and I never see it in the media, and I never see it on TV, is the GAF scores. You know what they are? Global Assessment of Functioning. It comes out of the DSM-4. What that is a scale of 0 to 100. And that's putting a number on somebody that's been identified with a mental illness. And the 0 is, 0 to 10 is you're a danger to yourself or to others. And from there it goes up to, if you're up around 100, you're somebody that people seek out because you got it together. But my question is, like, how come that's never talked about? I mean, if you're looking at a way to try to identify who these violent people are, somebody's already attached a number to it. But in the press, it's never talked about. Can you address that for me?
The GAF score is designed for treatment planning. What do we do for this person? How can we keep them safe? At what level of care do they need to be? And are they improving based on what we're doing? And so the problem with using a GAF score for an abridgment of someone's civil rights is it changes. You've seen yourself, I'm sure, people who come in so sick they couldn't even tell you what their name is, and then a week later they're able to have a very sensible conversation. And so I think the problem with background screening is that we're defining the problem in a way that can't be solved. There is no medical practitioner that I know of who would vouch that they could sort out for you who is potentially violent. The best indicators are a history of past violence. I don't think anybody with a history of past violence, for whatever their reason is, should have a gun. And that's where I'd end it. Because that we can prove, that is evidence-based. The fact that you're mentally ill means you have a lower probability of violence. So I think we're using our superstitions and myths and stigma to design a public policy that isn't even designed so that law enforcement can implement it. So it seems a waste of time and a distraction. It seems more helpful to say, yes, there should be background screening. It should be based on a history of violence. You should have to earn the right to carry a gun, license, safety, and then, go with God. There are many dangerous things that we're allowed to have. Guns are not the least of them, motorcycles and cars, and I mean, you can kill somebody with a baseball bat. So we're going to do background screenings for baseball bats. So I think we've defined the problem in a way that paints us in a corner. It's not enforceable. It doesn't make anything better. The real problem is history of violence, not mental illness.
I'm Kathleen Dodge, and I want to second that. Hearing today, I think the solution is make sure people get training, safety training, before they get a license. I mean, you have to do that if you get a hunting license. Why not to own a gun? But I have a couple questions about some of the incidents. For example, in the theater situation, he was seeing a psychiatrist. Now, what was missing in there that we need to put in? A system thing, I think, that will prevent that guy. The other thing is, as I was thinking about this kind of crime, I was also thinking of these serial killers. How do we detect a Ted Bundy and prevent a Ted Bundy? He was not identified by any mental health agency or anything. He was a charmer. Those sociopaths and psychopaths, how do we detect them? Okay, that's my question.
So what was the first question again?
What was missing in the system with a psychiatrist?
What was missing in the situation with the theater and the psychiatrist? That psychiatrist is, if I remember the details of the case, was affiliated with the school. There are federal laws that limit what psychiatrists can disclose under the Educational Act. And Karen Carpenter can probably give a more informed explanation of it. So we have to change federal law so that educational confidentiality is not a barrier to disclosing when there's a threat. In Florida, if a counselor meets with somebody who threatens anyone, we have a duty to warn. So it's real clear for us in the field. We have a duty to warn. If someone comes in and makes a threat to another individual by name and it's a credible threat, we have a duty to warn. But in the educational system, there are more limits. So there is a problem with the federal education law and confidentiality. Whether that was at play in that particular circumstance, I'm not informed enough. And then your second question was?
How do you detect those who, I don't know if they qualify as mentally ill, but like the Ted Bundys, the serial killers who I don't think he was ever detected by any mental health agency.
I think because we're not doing screening, lots of mental illnesses are not being detected, but there are early signs for the Ted Bundys of the world. Torturing animals is a big concern, because what a sociopath and a psychopath lack is an ability to feel the impact of their actions on another person. And it gives them an impunity. They have no conscience. But you can detect that predisposition if you screen.
Well, I really have several questions, and my concern prior to coming today was about incidents like the Newtown shooting led me to sad for the first time in my life with Rand Paul from my state of Kentucky. But he does feel that teachers should be armed in the schools. And it seems by having the restriction of not having firearms within the radius, a certain radius of the schools, we are saying you cannot protect yourselves or your children in that boundary, because that's not going to keep dangerous people out that rule that law. But it is going to make sure that good people who would want to have firearms are not there.
Okay, think about it this way. As a law enforcement officer, we go through hours and hours and months of training. To carry a firearm, we're required by law and by agency policy to requalify each month. And we, as in law enforcement officers, we practice every month. Now, people go out and they get concealed firearms permit. People go buy firearms for their house. They'll get the permit, they'll qualify, and then they'll put the gun in their house. It could be 2-3 years and maybe never fire that gun. So what happens if that teacher gets that gun? Is it going to be a policy for every teacher across the United States to so that would be the problem. They would have to have some type of a training.
Extensive.
Exactly.
Ongoing.
Yes. Yes.
But it doesn't make sense to have a law that you can't bring a gun within a certain radius. That's not going to keep bad people from they're going to get in with guns in that radius if they want to. But it makes sense to me that if those people can bring guns in, I hate to see armed guards in the school.
So real quick, I'll get you in a second. You know that a lot of Iraq and the Afghanistan war has occurred, right, and ongoing. So we have a lot of our young soldiers are coming home from war, and some of them, suffer from PTSD, correct? So we don't know when or how it's going to affect them. So we, as a law enforcement officer, will be most likely the first ones that will get that call. So as I explained to you earlier, I'm a negotiator, and we have an association, which most states do have our association is called the Florida Association Hostage Negotiator. And then we have others throughout the United States. So what we do is we have a yearly conference and we have ongoing training throughout the state to deal with PTSD. Now, we can break it down a level. People in law enforcement also suffer an instance from PTSD from the job. Because if you think about this in a 12-hour shift, that first law enforcement officer, he get a call. It could be a an infant that died or drowned or was smothered, and then he deals with that call, then he goes to another call. And that's a domestic where the husband has badly injured his wife. So he handles that and he goes to another call, and he goes to another. And that's just in one day. And then it starts all over again. You know, so you're hit with that daily. There's no outlet for him. He goes home, he or she goes home. He's not going to tell his wife because he doesn't want to let her know or tell the husband. They don't want them to know what happened. So PTSD not only affects the military, it affects law enforcement. I'm going to drop down another one. So, like I said earlier, you have a loved one that was injured or killed in an accident or suicide. You too can also suffer from PTSD. So it's not an illness that will just affect the military, because in years past we thought it was just people from Vietnam, but we called it something else. Now as the wars occurred, then we identified it and we thought it was just military, and then we thought it was just law enforcement, but it could be the general public. So.
Metropolitan Police officer in Washington, D.C., and he was in charge of community relations. One of his biggest things was that, you know, if there's more good community relations between law enforcement and the community, of course, there's more information always out there. The officer is aware of more, or maybe there's more comfortability, you know, to relating that kind of information. It's something like that. Is that a focus too for trying to help prevent this kind of things? More community involvement, so the public feels more comfortable with the officers that are in their community?
Yes, it is. And like I told you, back in 1979, a little while ago, when I started, you know, I was young, I was 19. The only thing I knew or what I was trained was you write tickets, you put people in jail. But no, I didn't beat anybody, that's all we did. I'm too small to do that, so. But as time passed, the philosophy that the sheriff's office has now is customer service. The public is what? Right, you're the customer. I provide customer service for you. We now go out because you all help us. In other words, we can't solve the problem by ourselves. It takes us and the community to solve a problem. Manatee Glens can't solve the problem by themselves. It's us and Manatee Glens. We work with a host of other agencies and communities. By being in crime prevention, I have the opportunity to go out with so many different communities to work closely with them, because without them, it wouldn't work. So imagine if I wasn't here today and you have all these questions related to law enforcement. Nobody can answer it. Am I right? So this is what we do because it helps bring crime down. It helps build a closer relationship with the community.
Ms. Beth Holloway. I'm a member of NAMI, and I have a brother with a mental illness. You can talk about screenings to the end of the world, and if there isn't any kind of way you can get them to take their medicine, I mean, tell you the truth, my brother, I'm more worried about his physical safety than I am his rights as a citizen, because his brain is broken and he cannot make that decision himself.
So, as I said earlier about the CIT training, by sending all the officers within the county to that training, now they know when they come upon somebody who just doesn't seem to be themselves, for safety, they keep their safety to make sure they don't get injured. But one of the first questions they're going to ask, are they on some type of medication? And that's a general question if you come and you see somebody that's down or have some type of issue. And if that person says, you know, name one of the drugs that you know is not a common drug, we're going to call EMS anyway. But we try to get that information, and again, like I said, we treat them with compassion. So they know, and when we get new officers, especially at the sheriff's office, when we get new officers every year, we try to send them through the training. And 2 years ago, we sent the SROs through that same training because they deal with so many kids in the school. And they didn't know what their options were until we sent them to the school. Now they're better informed. But we try to, like I said, we try to work with each patient, and that's why all our deputies are going through the training.
Well, I think the training is extraordinary, but Harry is his own worst enemy because he won't take
Okay,
medicine.
I'll let you take it, yes.
Outpatient commitment.
Okay.
This is where the field maybe doesn't serve itself. We're so concerned about people's civil rights, and why shouldn't we be? Look at the blame and stigma and discrimination. You know, we come from a place, we want to protect our people because the world doesn't. But there is a law in Florida called outpatient commitment, which allows people like your brother to be court-ordered to take their medication, and there are consequences if they don't. Florida has this outpatient commitment law. Did we fund it? No. Did we fund the training of officers or mental health professionals? No. But we do have that tool. I have no pause using outpatient commitment or inpatient commitment if someone's medical illness makes them unsafe. I wouldn't let somebody bleed to death, and I wouldn't let a mentally ill person come to harm because they're not in their right mind at that moment. So there are answers. We're reluctant as a society to implement them because from the point of view of a mentally ill person, why should they trust us to limit their civil rights? We don't have a very good track record.
And people with mental illnesses do not always remember their history.
I want to thank our speakers for their excellent presentations today. I want to thank the Bradenton Women's Club for the use of their hall, and we also want to thank METV for taping this program and replaying it on their station. For the TV schedule or to watch our program online, go on to www.metvweb.com. Also see our website, lwvmanatee.org, and we have a link on that right to their website. We also encourage you to join our league, and before we leave today, our treasurer would like to say a few words.
First of all, I'd like to thank METV and all of you for coming and participating in this hot topic. The League of Women Voters of Manatee, well, our mission is to encourage well-informed citizen participation in the political process. We provide nonpartisan, fact-based information on our website, in issue-specific presentations to the community groups, and in forums like these hot topics. And we provide written information, like the voter guides that we distributed prior to the last election that most folks found very helpful in trying to weed through all of the many amendments. Our ability to be effective depends on, in a large extent, the funding that we get. And so we invite you to join our league and, if you're so inclined, to make a donation so that we can continue to bring you these very informative hot topics as well as the other programs that we present. Please visit our website, as Rosalie said, www.lwvmanatee.org, or see me at the end of this program and bring your checkbook. Thank you.
And thank you all again for coming. And I'm sure our speakers would be willing to hang around for a few minutes if you have any other questions for them.